And I want to give you a warm greeting from New York City. A warm greeting to every one of you. Welcome to the Sexual and Reproductive Health and Rights Conversation Circles. This circle is sponsored by the NGO CSW New York. As I said, I am Azadeh Khalili, and I'm with the International Alliance of Women and the NGO CSW New York. And I'm co-leading this circle with my sister, Eleda. This is a space to raise issues and exchange ideas, about sexual and reproductive health and rights. Later during this session, we will break into small groups and give you a chance to do exactly that, to have a chance to speak with others who are passionate about this issue. We put together these conversation circles because we know there is so much smarts and there is so much expertise among everyone who is attending the NGO CSW New York Forum. And we wanted to create opportunities for you to have a chance to speak with one another. But before we do that, I want to go over the ground rules. These are ground rules that will create a safe environment for all of us to have a very productive, successful NGO CSW Forum experience. These rules are also written on our website for how to create virtual safety. But I want to go over a few issues before we start our session and really dive into the issues and then into conversations. So here at the NGO CSW, we believe in always building a space where we exercise compassion, integrity, and honesty. We respect one another. In these small circles, we want to encourage you to respect one another, to listen and avoid assumptions, to critique ideas and not people. We want you to allow everyone to participate, to not dominate the conversation and honor time limits. We will be putting limits on how much each person will be able to speak in these conversation circles. We want to respect the diversity of languages, opinions, and expertise while acknowledging that sexism, male domination, racism, classism, heterosexism, transphobia, LGBTQ discrimination, and global North domination and other institutionalized forms of oppression exist. We want to ask you to be positive and always seek unity with other members of your circle. This is a place where the voices of the marginalized are amplified and given priority. Their experiences of oppression are not up for any debate or to be refuted in any way. This is an anti-racist space. We're committed to anti-racism, and we ask you to welcome, value, and revere an intersectional approach to feminism. Feminism that also stands against the racist experiences of women of color, the class experiences of women from different classes. An anti-racist space requires that all of us need to consider our positionality and work actively not to replace white patriarchal structures, including subjugating voices of African American, Black women, and women of color, and women from Global South. NGO CSW will not tolerate any form of harassment of any kind. We stand against any kind of harassment. So if you do experience harassment, you can go, there is a specific place where you can go and file and let us know what happened. And if you can give us the details, that would be very helpful. There is a form on the virtual that we will post for you if you do experience that. It's called virtual safety at ngocsw.org. And we really hope that we will be able to have a very passionate, exciting, fruitful conversation at this conversation circle. Without further ado, I want to introduce my sister, who will introduce the rest of the work we will do now. Elena.
Thank you so much, Azadeh, for a very warm welcome. Hello, everyone. Good night, good evening, and good afternoon to all. Good night from a very cold night at Istanbul. I'm very glad to be here, and I'm loving the energy, just seeing amazing, strong women from different corners of the world getting together for meaningful conversation. This is powerful and this is beautiful. Now I would like to quickly jump into the next steps of our conversation circle. First of all, I want to share that obviously we are here today to share ideas and to have meaningful conversations, but we're also here to share resources and share information. So here you can see a few helpful links. I'll be sharing them in the chat. If your networks or NGOs have came up with recent reports on SRHR, if you want to share some info or reports or resources, please feel free to share them in the chat as well. Now we will watch a brief video that, in my opinion, perfectly summarizes the situation around sexual and reproductive health and rights and women's rights in general. So let's watch that and let's then jump into conversation and discussion.
There's no sound. We should start it again.
When you share, you have to click, there's a button at the bottom, like a checkbox that says share computer sound.
All right, let me quickly try to, just a second, please. I don't think that works. Could someone?
I think you have to stop sharing and then reshare.
All right, I will quickly do that. My apologies, everyone.
No worries.
All right. I think I solved the problem and I'm starting it again. Okay.
What is the state of women's health? According to the World Health Organization, maternal deaths have reduced by 45% since 1990. The number of women receiving prenatal care is up by 18%, and women will outlive men by an average of 4.5 years. However, longer life doesn't necessarily mean quality life. Because of discrimination, women are more likely to have poor physical, sexual, and mental health. Gender inequality means women have less access to information, care, and basic practices. That's a risk to women's health. According to a 2015 World Women's Report, Practices such as early and forced marriage, poor access to information and education, lack of decision-making power within the couple, and violence against women increase the exposure of adolescent girls and adult women to sexually transmitted infections like HIV. These practices also play a role in early pregnancies, which can lead to unsafe abortions and adds to maternal death statistics. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And women have the right to the enjoyment of the highest attainable standard of physical and mental health. Support maternal and emergency obstetric care as agreed to in the Program of Action at the 1994 International Conference on Population and Development. Take action to ensure necessary conditions for women to exercise their reproductive rights and eliminate coercive laws and practices on reproductive health. Increase financial support to address the social, economic, and political causes of women's health problems, including the impact of gender and age inequalities, especially related to chronic and non-communicable diseases. Support research to address gender inequality related to cardiovascular diseases, cancers, reproductive tract infections and injuries, HIV/AIDS, and other sexually transmitted diseases, domestic violence, occupational health, disabilities, environmentally related health problems, tropical diseases, and health aspects of aging.
My apologies for the little technical problem again. We hope that this video has given you a basic idea and has given you some inspiration for the upcoming discussion. Now, without further ado, I'm going to give the floor back to my sister Azadeh to kind of prepare us for the discussion ahead.
Thank you very much. It's always good to go back to the Beijing Platform of Action, since over 190 governments of the world signed on to the Beijing Platform of Action. So now we want to, since this is a conversation circle, we want to give you the opportunity to have a conversation among yourselves. And we're going to break you into smaller groups. And in these groups, I am going to ask you to please do a few things. First, we're going to probably divide you into groups where there will be 6 of you. And in every group, I want you to divide the 30 minutes that we're giving you in your group, divide 30 minutes among the number of people who are in your groups. So each person will get equal time to speak. As you know, some of us are shy, some of us like to talk a lot. So we want to make sure that no one person dominates the conversation in these groups. So please take the 30 minutes and divide it among the numbers of the people in your group, and each person will have equal time. I'm going to ask one person to please be the timekeeper. That person, the timekeeper, can use their cell phone and use the timer and time the time for 5 minutes, 4 minutes, the amount of time that you have. So each person will have 4 minutes, let's say, to speak. And I'm going to ask one person to be the recording officer for the group, to be ready when you come back. We may call on you to give us a 1-minute summary of what happened in your group. So again, remember, one person will be the timekeeper and one person will be ready to come back and report back to the larger group about to give us a summary of what happened in your group. I wish you a wonderful conversation. You're going to meet people from all around the globe, and you will have a chance to really speak about issues that you're passionate about. Please do not interrupt each other when someone is speaking, when it's their time. Do not interrupt it. And as much as possible, try not to refer to what other people say. Really try to stick to your ideas and what you want to share with the group. So at this point, we're ready to be broken into smaller groups. And you will see a button that says join. Go ahead and press that button and you will be joined.
Yeah, thank you so much, Azadeh. I definitely agree with you. I could have talked for hours with the amazing women in my group, and I learned so much. And it's also always fascinating to hear how common some experiences are, no matter where you are. despite the fact that you're living in different corners of the world, experiences are still the same. Anyways, now we want to do this little debrief, and I want to choose 5 representatives from breakout rooms. Unfortunately, I don't think we will have time to hear every breakout room's representatives, but those who would volunteer, please go ahead and raise your hands. I will see you and give the floor to you. Just a second, please, until I see okay, let's start with Nicole. Please try to summarize the main points in around a minute. I know it's hard, but you have the floor.
Hi, everyone. I'm Nicole. I'm based in Washington, D.C. in the States. And my group, we talked about the intersectional and interdisciplinary approaches to addressing various forms of sexual and reproductive access. Some of those things included menstrual education, hygiene, and period poverty. Using the reproductive justice framework to focus on not only funding, but also access and respect to wherever choice a woman decides to choose. And that also includes access to mental health services, access to making medical appointments, which also includes abortion access, and also support for individuals who choose to carry their pregnancies to term. And that includes maternal health care and breastfeeding support. And also working more interdisciplinary to recognize victims of human trafficking and also victims of different types of intimate partner violence, and also supporting individuals who are pregnant and in jail as well.
Thank you so much, Nicole, for a brilliant summary. Now I would like to give the floor to Colette. You have the floor for your summary. Go ahead.
Hi, my name is Colette. I'm currently a high school student and I'm from the United States. We talked about a lot in my group, so this can be a little hard. We talked about Black women and women of color and their big gap of how they are more likely to die in childbirth, and doctors won't prescribe them the right pain medications and stuff because they think that they can withstand more pain. We talked about definitely birth control and abortion access. And then one thing we talked a lot about was education. As a youth, we all felt that it was very important to start from a young age for kids to start learning about this so there aren't as many stigmas around it. I know I didn't learn about it from a young age, so I didn't ever want to talk about it at all. So the importance of especially young men and women both, we all need to learn about each other. So yeah, that's basically what we talked about.
Thank you so much. That sounds very interesting and noted. Now I'm jumping to Steph Perrin for her remarks.
Hi, everyone. Thanks to my group for a really wonderful discussion. We had representation from Canada, the United States, Madagascar, and Trinidad and Tobago. And we spoke about SRHR education and access to health services and access to abortion in particular. And just generally speaking, the ways that SRHR underlies women and girls' ability to be agents in their own lives and pursue their own empowerment. We talked about SRHR in Africa, where SRHR is often still taboo, but there is progress being made. We spoke about how things are moving forward regarding high school curriculum and that youth and especially young women are the primary targets, and that sexual and health services and birth control are still limited, but there are bills about abortion being passed, even if it's only for medical and health reasons. And then we did move on to a more in-depth discussion about access to abortion and the importance of choice to have an abortion or not to, and that choice goes both ways, and that it's important for there was a need identified to screen for both coercion and for intimate partner violence and how those inform a person's choice to have an abortion. And we did get into some discussion about the ways that the Beijing Declaration discusses access to abortion, and it's framing around choice and access to information about abortion and post-abortion counseling. So I think I'll leave it there. I probably went a little bit over. Thank you all.
Thank you. Thank you so much. Now we jump to Radwa Mohammed. You can go ahead, please.
Hello, everyone. The conversation we had, since it's from different countries, of course, we had different challenges to meet us. Lily and Lucy from USA, I think they said something similar to what Colette shared with us, that there is no access for health facilities for everyone. So basically, the marginalized categories that include women of color and even white single moms get actually more marginalized. We had, of course, other participants from South America that shared to us with us that actually the gender issues and the reproductive issues, they don't actually contribute to the concern of policymakers in their countries. They don't actually a matter of concern. In my country, Egypt, we have other problems. We still have circumcision as a cultural tradition, which is actually very brutal against women and children, actually, since it's performed at a very young age. We don't have access, free access to abortion. We don't have post-intercourse bells available for emergencies, available for women. So we have many challenges when it comes to reproductive health in our culture. Well, thank you.
Thank you so much, Radwa. Now I will jump to Rahel. If I pronounce your name correctly, my apologies. Please go ahead.
تشكر مرحبا. So our group also had a very diverse geographic representation, including Indigenous women from Saskatchewan, Canada, young women in England, I believe, Ecuador, and the United States, and other parts of Canada. Similar to what previous groups shared from their discussion, we also devoted a lot of time to talking about how to reach young women and girls, but also young boys from an even earlier age. Several of the group members raised the challenge that a lot of people don't have access to medically accurate sexual health information until they're later on in high school or even college. And there is a big need to start providing that information younger, and also to involve the entire family unit. We talked about different models of school-based health and school-based health programs, and how they can be very effective in engaging the parents and the entire family in talking openly and candidly about topics that frankly are highly stigmatized, including menstruation, including, you know, the whole gamut of sexual and reproductive health. The other challenge that we talked about is what to do now that we're living in COVID times during this pandemic, where a lot of children are not in school. And a lot of the platforms that we have been using to provide discussion groups, to provide programs to disseminate information that is medically accurate are no longer there. And now a lot of young people are getting their information from the internet, and unfortunately, they're getting a lot of inaccurate information. A lot of young people, especially young girls, are also being much more vulnerable and experiencing cyber harassment and cyberbullying. So that's an added challenge. But as one of our group members noted, this challenge also has a benefit. For example, look at the CSW right now. This has increased participation amongst rural women, amongst Indigenous women, amongst women who normally may not be able to afford to come to New York, but now, because everything is virtual, we have many more opportunities and many more possibilities. Another model that one of our group members raised was using SMS messaging systems and buddy systems, particularly amongst mothers and amongst primary caregivers in the home. So those are a couple of things.
Thank you so much, Rahel.
Yeah.
I'm so sorry. I apologize that I won't be able to give the floor to everyone who has raised their hands. My deepest apologies, but I will give the floor to 2 more people that I will randomly select. But we will try to find ways to discuss more in the chat box. So I'll give the floor to Sarah Rocha now. Please try to keep it to 1 minute. I know it's hard, but thank you so much.
Hi, I'm Sarah. I'm from the UK. I'm just going to try to be super quick. We talk about the need for sex education on consent, and especially directed to disabled people. We don't have a lot of sex ed to the specific problems that disability brings. We also talked about forced sterilization of disabled women. In Spain, it was outlawed just last year, and Indigenous women in Canada. We also talk about the confidence to give to girls to advocate to sexual and medical rights, menstrual education and period poverty, and the need to provide period packs and free period materials. And last of all, we talk about the lack of reporting on sexual abuse and the need to get safe spaces for women to report. Thank you.
Thank you so much. Now I will give the floor to Alice Fuchs for a very short 1-minute summary.
I'll be as quick as I can. Our group covered the challenges of updating sexual and reproductive health rights into the school curriculum with great difficulties with government officials who don't have updated knowledge or little impetus to carry it through into national curriculum. In Canada, the example was given. A student who spoke of little of any, having received little if any sexual and reproductive health rights education, it mostly was about drug abuse, although it might have been called SRHR. Another key point was regarding the effect of population on the environment, normally seen as a southern states issue. Actually, it's northern states issue, and whether the person concerned was interested to know whether whether anybody had made a conscious decision not to have children because of the environment, and also the access that women with autism have to healthcare, particularly if they have a late diagnosis. And that was a whole other fascinating area which we learned something about. Then we also looked at the Swedish model, which is far ahead of many other countries, and the difficult issue of abortion for a big membership group that may have member countries that actually where abortion is illegal. So it was very interesting for us all to hear that. And then finally, the impact of COVID-19 and even less access for young women to access clinics, particularly in fragile, failing states, schools closed, no access to discussing, fears of FGM, child marriage, unwanted pregnancy, those things. I'm going to stop there.
Thank you so much. And my apologies to everyone that I wasn't able to give the floor to. Because we will have to break out into rooms again for the second half of our discussion. But please feel free to write your ideas on the chat. Now, without further ado, I will give the floor to Azadeh for her preparation for us to introduce the second half of our discussion. Go ahead, Azadeh.
Thank you. Great conversations all around. And we have 2 more weeks here at the NGO CSW Forum. And I'm so excited that you will have a chance to bring these ideas to more events. So we're going to now break into another group and give you 15 minutes in your groups to have a chance to discuss the following questions. What are your next steps? What commitments can you make as we move forward? So we would like you to, as much as possible, you can speak on a personal level, what your personal next steps are, what your personal commitments are, or you can speak to the next steps of your organization or your nation, or the commitments that your organization can make to some of these issues. So we're going to ask these questions. We will put them in the chat box. And we're going to ask Devin and Raha to please break us into small groups.